Step right up. Today is Giving Shoesday. Lepra is turning Giving Tuesday into Giving Shoesday. Giving Tuesday was created in 2012 as a simple idea, a day that encourages people to do good. Over the last decade, this idea has grown into a global movement that inspires millions of people to give, collaborate, and celebrate generosity. This International Day of Giving, Lepra is shining the spotlight on just how transformative tailor-made footwear can be for people affected by leprosy. Lepra have partnered up with world-renowned family-owned footwear retailer Pavers Shoes to deliver custom-made shoes to those affected by leprosy and LF. Back in 2015, Pavers worked with Lepra to provide the first mobile shoe van, which travelled across the Indian state of Bihar, delivering custom-made shoes to those in need. Lepra provides free, protective, tailor-made footwear to help people walk comfortably and without fear of possible injury, restoring a sense of independence and enabling them to return to their communities and work for a living. Mobile shoe vans, staffed with highly skilled shoe technicians, measure and deliver footwear across isolated and remote regions. The shoes are made from a special multicellular rubber, or MCR, and designed to protect ulcerated feet and promote healing. This Giving Shoesday, Lepra hopes that we can move one step closer to changing the lives of people affected by leprosy. Today we are joined by Lepra's Chief Executive, Jimmy Innes, and Lepra Ambassador and MD of Pavers Shoes, Stuart Paver, to discuss this important initiative. Thanks so much both for joining us today. And Jimmy, if we could start with you, can you tell us a bit about Giving Shoesday?
So Giving Shoesday is our take on something that's known as Giving Tuesday. And Giving Tuesday is a global platform. It's a day. It's been going since 2012. For people, it's to celebrate generosity and doing good in the world. And charities such as ours use the opportunity to raise awareness of our causes, about what we're trying to do to make the world a better place for people to live in, and to encourage the general public to support our causes. So for us, as Lepra, I work for an organisation called Lepra, and we're involved in supporting the control of leprosy in the world. So for us, we've turned Giving Tuesday into Giving Shoesday, because for us, the provision of low-cost, tailor-made, protective footwear for persons affected by leprosy is a cornerstone of our approach. And this year, for Giving Shoesday, we've asked some of our celebrity supporters and endorsers to donate pairs of their shoes, which we're now auctioning off online between now and the 4th of December. So people, if they're interested, they can make a bid for these shoes online, and all the proceeds that we raise from the auction will be used to support our work providing footwear for persons affected by leprosy. And this year we are delighted to have some amazing footwear donated from some very high-profile individuals, including Virat Kohli, the global megastar Indian cricketer, Rory McIlroy, the world's #1 golfer, Dame Judi Dench, the actress, Sir Tony Robinson, the TV personality, Hannah Cockcroft, OBE, who's a wheelchair gold medalist, sprinter, Paralympian, and Danny John Jules, who's an actor, and listeners will remember him as being the cat from Red Dwarf, as well as being in Death in Paradise.
Outstanding. And Stuart, what made you want to get involved with the campaign?
Well, I'm from Yorkshire with Scottish roots, so I naturally like value for money. Our business has grown around comfort and value, so when Lepra approached with a concept for a mobile shoe factory that would deliver comfort in a cost-effective way and help people suffering from leprosy, I was interested. At that point, I had no idea leprosy still existed. So we met up a few times to understand how it would work and the resulting benefit to some of the hardest hit people in the poorest states of India. And I was hooked when we were convinced we could change people's lives for £6 a pair. There are very few other opportunities to make such a difference for so little money.
Excellent answer. And I understand you visited India. Could you please tell us a bit about your experiences there?
Once the vans were up and running, we went to visit a number of colonies and villages to watch it in action. it was an amazing experience to watch these craftsmen measure people's feet and then make made-to-measure orthotic sandals for people who couldn't possibly buy standard footwear. One lady we met had spent over 2 years unable to walk and had been pushed around in a wooden cart due to severe infected ulcers in her feet. However, after 2 pairs of these sandals, which were custom made to relieve the pressure on her feet, on the ulcers, she was back on her feet, taking her children to school and walking to the market. Can you imagine the effect on that whole family for just £12?
Excellent answer. Thank you, Stuart. And many of us may not be aware that leprosy still exists. Can one of you describe the condition and how it impacts lives in 2022?
Yes, so leprosy is very much still prevalent in many countries of the world. There's about 19 or 20 what are considered to be higher burden countries in the world. And every year the World Health Organization, WHO, reports around about 200,000 cases of leprosy in the world. And of those cases, 60% of them are in India, which has by far the highest burden of leprosy in the world for any country. And in the last couple of years, 2020, 2021, we've seen a decline in those figures, but it's not a true decline. It's been caused by COVID. So, for example, in 2021, the WHO reported about 140,000 cases only. And COVID has had a 40 or 50% drop in the number of cases due to people being in lockdown, health centres not being open or accessible, transport systems not working, etc. So that's a cause for concern about these missed cases, the COVID gap, we call it. But generally speaking, it's about 200,000 cases a year. It is coming down over time. There's lots of progress being made. But from our work at the grassroots level in India and Bangladesh, we estimate that for every case that's diagnosed, there's at least one which is undiagnosed. So if 200,000 cases a year are being diagnosed, there's at least another 200,000 that aren't every year. And we estimate there's at least 3 million people in the world who live with the lifelong impacts of being affected by leprosy in their lives. Now, leprosy is a disease that is best diagnosed early, but it's very difficult to diagnose early because the signs and symptoms of leprosy can take a long time to show, even 5, 10, even 20 years before anybody displays any symptoms. And typically what leprosy does, it affects the nervous system, affects your nerves. So in your fingers and your toes and the extremities of the body, your nose, your ears, your eyelids, these are the places where leprosy, where your nerve damage is noticed. And that can cause loss of feeling. It can cause an impairment by itself, but it can cause secondary issues as well. So if you don't feel in your fingers and you burn yourself on the stove, you don't know you've burnt yourself. That burn can fester, it can become infected. It can become a debilitating wound over time, which can cause a lifelong impairment. Similarly, in your feet, if you stand on a bit of glass or a stone or a stick or something like that and get an infection in the base of your foot, you may not know it's there because you can't feel it. And it's a hard place to see because it's right down at the other end of your body. And many people with leprosy live with the constant threat and issues of having to manage ulcers in their feet, which can cause severe mobility and impairments lifelong. And that's why the shoe wear is such an important aspect of the work, because for a person affected by leprosy who has mobility issues and impairments in their feet, it's very hard to move around and participate in society. But if you have a pair of shoes which is specifically fitted to the shape of your feet, which might be different from one foot to the other, and which protect any specific ulcers you may have, and which are contoured to the right shape of the shape of your foot, and they're comfortable, they enable you, they give you mobility where otherwise you didn't have it, and they're empowering, they're transformational as a result. And people who have been affected by leprosy, who can get access to this footwear at no cost to them, provided by the charity, it really is transformational and enables people to participate and enjoy the benefits of society on an equal footing to anybody else.
Outstanding. And can you tell us a bit more about the work Lepra does internationally?
So internationally, we currently work in 2 countries, India and Bangladesh, and we support across what we call the spectrum of support. Now that starts with diagnosing cases as early as possible and ensuring access to treatment and care to cure people of their leprosy. But then for people who live with the lifelong impacts of leprosy, we provide an ongoing program of care and support, mental health and well-being, access to livelihoods and self-help groups and self-care groups for ongoing self-care, access to ongoing medical treatment, etc. And then the final part of our spectrum is then supporting the inclusion of persons affected by leprosy in society, breaking down the terrible discrimination barriers that still exist against people affected by leprosy in the world. A positive diagnosis of leprosy has a connotation of ostracization, being outcast, and the discrimination. It's one of the most discriminated diseases in the world. And for people who've been diagnosed with leprosy, they have a very difficult situation to be able to live within such pervasive societal discrimination, starting in their own home, in their communities, in their schools, and in society at large. So we work to advocate and to raise awareness that people affected by leprosy have the right to enjoy society just like anybody else.
Fantastic stuff. And where should listeners go for more information, please?
So our organisation is Lepra, that's Lepra, Lepra, and our website is www.lepra.org.uk. And if listeners are interested, they can Google us and go to our website, and there they'll find information more about leprosy, about the work we do, and also about our Giving Shoesday auction and appeal. And people, if they're interested, can make a bid for any of the shoes, celebrity shoe wear that's there. Otherwise, we'd be delighted and encourage people to give whatever they can to support us in our worthy cause. And at this time of year, between now and early 2023, we run a campaign called £1 from you, we get two. So for every £1 raised from public donations now, we have other donors, existing supporters of the organisation, who will match that with another £1. So if anybody wishes to donate £6 to help us provide a pair of tailor-made shoes for a person affected by leprosy in India, then our other donors will match that with another £6 to ensure we can provide a second pair. And for any listeners who are in or around the Ripon area, next week on Tuesday, we'll be at Ripon Cathedral raising awareness of our cause. And for anybody who's there, please do drop by and meet our teams and learn more about the work we do in the world.